So the other day I was working out. As I finished up, put the weight down and just tweaked my back a little bit. And it was okay because I knew what to expect, the whole physical therapist thing. But then Ryan and I started talking about it. What if you're not a physical therapist, which most of you are not? How do you know how to pick a physical therapist to go see? Let's say you watched our videos and you did our home care, you tried some of the back pain advice we gave you and it's still not going away and you're gonna go see a physical therapist. How do you pick the right one for you? How do you know it's a good fit? And let's be honest here, how do you know it's a good physical therapist? So this video, we're gonna go over the things you should ask your physical therapist, you should question, and it will kind of help determine if it's a good fit for you. This is how to pick a physical therapist for you.
Most physical therapy clinics are direct access. Now that means you don't need a script from your primary care physician. And that's great news because you can get in right away. So looking for a clinic or a physical therapist that allows you to do that is a great first step.
So when you make your first call, it's important to find out the type of place you're going to see. A lot of physical therapy clinics are very, very busy. So you have to figure out whether you are kind of a big university type of person or you're more of a liberal arts person, meaning are you okay being in an environment with a lot of people, maybe seeing a little bit less time with the actual physical therapist, or do you want to have that one-on-one attention and have more time with the clinician? So ask, am I going to be one-on-one with a physical therapist, or am I going to see a physical therapist and maybe be aid and do more exercises? Either one can work for you and both have good outcomes in the end, but you have to know what you're getting.
From there, we want to make sure that you're starting to build a relationship with your physical therapists. And we can look at that in 3 ways. Number 1, the physical therapist should always have your goals and the activities that you want to get back to in mind and make that the priority. Keeping you moving, looking at your health is the most important thing. It should be patient-centered care.
Next, let's talk about costs. I know it's complicated, it's confusing, and it's stressful for everyone involved, I promise you. But when you're calling, you should know what to expect to pay. You would, whether you're going to the store, you should with healthcare. Physical therapy is no different. There's 2 types of models at this point: traditional, insurance-based, and out-of-network or cash-based, which is we are at Recharge. Either one can work for you, and they both have their benefits. For insurance-based, you should still know what to expect to pay based on your copays and deductibles, so make sure you ask. For out-of-network, like we are at Recharge, we have a flat rate for you, no matter what, and then you can get reimbursed by your insurance company. So you have an upfront cost, but then you still get that money back. But you should know going in what to expect to pay so there are no surprises. If the clinic is giving you a hard time without giving you at least a very close estimate, then you should be concerned.
Now, all physical therapists should see you as a person. In our world, we call this the biopsychosocial approach. But all that means is that we're looking at not only, okay, your knee hurts, but also how is it affecting your life? How is it affecting how you think about your own body? And understanding that your nutrition, your sleep, your relationships with friends and family are just as important to helping you get better as whatever is going on in your knee, shoulder, back, what have you.
So finances, you pick your physical therapist, you're getting in there, and what about the duration of your treatment? Now, there are some conditions, like say if you had surgery, that you can say we'll see you X amount of times for 12 weeks, because that's how long it takes to heal. But typically, it's very hard to say that this will take 8 weeks, 12 weeks, 16 weeks. So if somebody says, we're gonna see you for 20 sessions, you should be a little bit concerned about that. In other words, when you're getting treatment, it should be almost a 1-by-1 or week-by-week progression because your healing and your progression is unique to you. So as you're progressing, as you're seeing your physical therapist, it should be a week-by-week or treatment-by-treatment approach because it will always vary based on how you adjust and how your body accepts the treatments and the movements. So don't buy into long periods of time because they're a bit arbitrary.
All that being said, you should have a great understanding that you know what is going on with you, how long it should take, what you can do about it yourself, how we as a physical therapist can help you, and then where to go from there. Those are great starting points for you having an ability for the physical therapist to meet your expectations or exceed them. If you find a clinician and build a relationship like that, you're going to be in good hands and you're going to get back to activity, exercise in your life in a way that is rewarding and with you in control.